You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. Probably the busiest implant dentist in all of Texas. We've had him on the program before, Dr. Clark Damon. Dr. Damon, welcome to the program.
Well, hi Randy. Thanks for having me out again.
And I know you brought a stack of photos, so we'll try to get to as many of those as possible. I mean, you are like one of the busiest guys in all of Texas. Is that fair to say?
Fair to say. We do about 250 fixed cases a year, and that's about 50 implants a week.
So you do more in like a week than most dentists are going to do in a year.
Correct.
Yeah. So good for you. And you also train dentists. That means the things we're talking about today, you teach other dentists.
Correct.
Across the country?
This is something that I eat, breathe, and sleep on.
Okay, good.
We have the Texas Implant Institute that I'm co-director of. So we've taught over 250 dentists from across the USA on how to do permanent fixed implants.
So you're teaching them this so-called digital workflow where it's, in other words, you could do it in like 2 or 3 visits?
Yes.
Okay.
So what we teach, we have 3 or 4 different courses. So we do a full digital workflow where this can be done in 2 to 3 visits, can be done digitally, and it's the most precise way to do it.
Okay, good. Now, we should mention too, as far as implant dentistry, that how implants are still done, correct me if I'm wrong, you go to one place that does the surgery, another place where the doctor puts the teeth on top, and then oftentimes get them maintained elsewhere. You do it all right there. You have an in-house lab and the whole thing.
We have a purpose-built facility where we combine the surgical suite, the dental lab, and the restorative dental office. Everything happens in my facility.
So is this right? I mean, you guys actually have like digital printers that make the teeth right there.
We have 3D digital printers. We have dental mills that actually drill this stuff out. We have 4 of them. We're really proud to say, I think we have the largest milling in-office facility in Texas.
You know, I have dentists that come on the program and they'll say, they're giving me the inside scoop. They'll say, Randy, it really takes about 10, 11 months. And then I tell them about guys like you, and they almost don't believe it.
Yeah, we are using technology, and it requires you to do a lot of cases to have this investment in this technology. But we're using this technology to make it easy for patients, quicker, faster, better.
So somebody watching this, maybe they have a denture or teeth that are so bad they have to all be removed. If you had the time in your schedule, a few days from now they could have their brand new teeth.
Correct.
Is that right?
Yes.
That's not an exaggeration.
Randy, we had a guy come from Seattle.
Okay.
He showed up. We did a telemedicine consult. We then verified everything when he came in.
Like a Zoom type of a call? Okay.
Zoom call. He came in. We saw him for records and digital impressions at 8 in the morning. We were doing surgery at 9.
What did he have going on, by the way?
Bleeding gums, bad breath, loose teeth. He had years where he was just unhappy with his teeth. He had been unhappy with his teeth since probably grade school. And so he finally decided to do something about it. One of our patients that we took care of referred him. So he came all the way from Seattle. And literally within a couple of hours, we were able to transform his entire process.
How soon can they eat?
That night. Okay. I tell all of them they could have a soft hamburger that night.
Now I'm going to put you on the spot here because you're at the highest level. Most dentists that do implants know who you are. Does it cost more to go to a guy like you?
Surprisingly, Randy, it does not. And in fact, it actually saves money long term because when you get it done right the first time, it saves you money.
Okay, good.
I mean, I can show you cases where we've been referred the patient to, eliminate their trouble after, maybe not having the greatest experience before.
So what's changed since last time you were on the show? What's the biggest change in implant dentistry?
The biggest change is we're doing it faster. With all of our technology that we have, we are finalizing these cases in what used to take 10, 12 months into a very short period of time. We are actually developing a process to get this done in one visit for a one-step final.
Really? Okay, well, good for you. And you say literally it changes somebody's life. That's what the patients tell you.
Yeah.
Is that accurate?
patients will tell me, I wish that we had done this earlier. They will tell me things like, I can eat Cheetos. I can eat ice cream and it doesn't hurt my teeth. I can eat salads, and they can eat healthier. And you know, Randy, in today's environment where we have COVID going on, you want to be as healthy as you can. And what's the first step in that? Eating healthy foods. And so if you can't eat healthy foods, foods that have fiber, steak, chicken, these types of things, you're not going to be healthy for your whole rest of your body.
What do they like more, what they can eat or the way it looks?
Well, they start off liking what they can eat because they report the great things that they can eat now, salads, vegetables, but then they start taking selfies. They start realizing that their teeth look pretty darn good, and then that shifts. They are very proud of their smile. So what started off as a lifestyle thing and going after the best function and ability to eat and chew and correct a bite, well, now they're super happy about their aesthetics.
So it's the big challenge, like it was when I first met you, that people just put it off and put it off and put it off, especially the men. They wait until they're in so much pain, they finally have to call you. But you say people watch your interview over and over for years, and then they finally come in.
Yeah, we hear that. The patients sometimes, they say, I feel like I already know you. They'll watch it over and over. What I tell to those patients is the hardest part is just picking up the phone call and making the first visit.
Yeah.
In fact, we had one patient recently tell me he'd seen it for years, made a phone call, canceled the appointment, saw it again, and then finally decided, okay, I got the courage this time, I'm going to go in. But Randy, it's easy. We sedate these patients.
Do you have an anesthesiologist?
We have a MD anesthesiologist on staff.
Okay, that's nice.
So the patients are out for the case. We do this as best that it can be done, and these patients have a wonderful experience.
But you don't like these snap-in. I mean, you've done them, but you don't really like them. Why? Because it's a thing. It seems like I see it in ads across the country.
It is a thing, and it's a thing for guys who are just starting out. So what they
like
have
the
to...
dentists, you mean, that are just learning this?
Young dentists.
Okay.
For junior providers is a nice phrase that I like to call that.
Okay.
You got to take the teeth out. You got to get into a denture. Then you got to have implants placed. And these are 4 separate surgical interventions and surgical steps. And at the end of it, patients have paid a lot of money for a snap-in, snap-out, but yet they're left unfilled expectations.
So it's still a denture.
It is still a denture. It's still loose. It still rocks. It'll still pop out. You still have full palatal coverage. It covers the whole palate, so you can't taste very well. And you're still, at the end of the day, wearing dentures. Why not let me give them permanent fixed teeth with our permanent implant process?
Now, what about the people watching this that have a snap-in, snap-out denture? Can you graduate them and convert them to a fixed upper and lower teeth that don't come out?
It's very possible. That requires a consultation. We got to look at it, but on occasion we've done that before. And we've actually had some of our own patients come in that we've done a snap-in just because of finances. We've graduated them to a permanent fixed prosthesis.
Okay, good. Now, we should mention Medicare doesn't cover this, Medicaid doesn't cover this, even the best dental insurance covers like almost nothing.
Well,
but you say people are financing this.
Yeah.
Is that right?
Patients tell me all the time, you do so many of these cases, I can't believe all these people can afford this, right? Well, Medicare doesn't cover it, Medicaid doesn't cover it, dental insurance only covers a small portion of this, but we offer financing.
Are people financing this? Like every day?
90% of our patients are doing some form of financing for this.
Okay.
And Randy, did you know, with financing, for about $4 a meal, over 4 years, you can get permanent fixed upper and lower teeth.
That's nice. That's a good way to put it. Do you tell that to the patients sometimes?
We try to.
Yeah.
So.
And everybody, like you said, they all have regrets, which is
they didn't do it soon enough.
And this is the most, I think you told me that the most expensive thing about the procedure is all the going out to eat and traveling, tasting the local food.
After, right? Yeah, getting your life back. This is a lifestyle thing for patients.
Do people do this like for occasions, like getting married or dating again?
Our average patient is about 40 to 45 years old.
Okay.
And what they come in with is they are ready to get back into the dating game. They are trying to change themselves to be a better person, and oftentimes with that, they're putting their bad teeth in the dust. And so we're able to help them along that process. We're getting patients ready for marriages. We're getting patients ready to walk their daughters down the aisle.
It's nice.
Yeah, so it's fun for me to be a part of that process and realize kind of what role that I got to play in that. Those are treating higher needs for our patients, which is a lot of fun.
Okay, you brought photos. What are we looking at?
So here we have Jennifer.
Okay.
She's a nurse locally. In fact, we just recently treated her.
Okay.
And Jennifer came to me, and she didn't like her teeth. She told me that her teeth were a little dark, a little dingy. She was missing all of her back teeth. She was just having a lot of trouble.
Couldn't chew?
She couldn't chew. She couldn't eat. She just didn't feel confident with her teeth either.
Okay.
So she said, Dr. Damon, I saw your program. I want to be one of your patients.
Okay.
And in one procedure in one day, we gave her permanent fixed upper and lower teeth.
That looks good.
Yeah, that's her immediate after smile. In fact, that's actually her 2-week post-op visit. So at 2 weeks, she is not very swollen. She's actually looking really amazing. So.
And this was all done in your lab?
This was all done in our office.
Very nice.
Everything handled right there in house. And
so she actually could have been in a denture. That was one of her options?
She only had 2 options, which is permanent implants or a denture. And she's one of the subset of patients we see that actually fears a denture. And so they've kind of put off going to the dentist because they think in their mind, a denture is the only option. Thank goodness she found me, or she would have wound up going to somebody else and maybe getting a snap in, snap out or something.
You said that some people have been told elsewhere that their only option was a denture.
Correct.
Really?
Well, if they see a junior provider, maybe they're not looking at other areas of bone that some patients have.
But isn't it true if you've been wearing a denture for like 10 years, you can't do this because you don't have enough bone?
That is absolutely incorrect.
Okay.
Randy, there is almost nobody we cannot treat with dental implants.
Okay.
One thing we're able to do with our patients is use advanced implants, maybe some longer implants. Maybe we go into different areas of the face or the jaw that have bone, and we'll attach it there.
So you teach this to other dentists as far as these complex, difficult situations with patients?
Correct.
Is that right?
Yeah, we teach it. We teach advanced zygomatic and pterygoid concepts. We teach this all-on-6 that you've heard about, which is utilizing more implants for patients that have less bone. We've kind of found that more is better on less bone types of situations. And we can very safely and efficiently and effectively place these all with one procedure in one day.
So like 6 implants for the whole set of teeth?
For the top, and then we can do 6 implants on the lower as well.
Very nice.
Okay.
And then they're eating that night. Now when they're healed up, they can eat like a carrot with their front teeth, or you got to be careful with stuff like that?
When they're in their final teeth, they don't have to be careful with anything.
Nuts? They can eat like
any
almonds?
nut they want. They can eat all fresh fruits, uncooked vegetables, nuts, almonds, croutons, anything. Just not rocks.
Just not rocks. So just like you're not supposed to eat ice, you could probably eat ice with this, but you don't recommend that.
You can eat all the ice you want. We're making these prostheses out of full thickness zirconia. Super
So the
strong.
teeth are made of zirconia. Okay.
They're beautiful, and then we layer porcelain over that. It's the best aesthetics, and it's the best long term, and it's the strongest procedure we have in full arch implant dentistry.
Now, what if you have bad gums, though? Really, like gum disease? Can you still get implants?
That's who our patients are.
Okay.
So, yes, gum disease, we treat that whenever we remove the teeth and put in implants. There is no barrier there. that is the subset of patients who we're treating. Patients with severe periodontal disease, these are the lives that we are resurrecting with our dental implants.
How old can you be to do this? Like, what's your oldest patient?
87.
87. Why would an 87-year-old want to do this?
Well, I can tell you about one of our patients recently. She was facing a feeding tube. She had gotten dentures 9 months earlier. She drove 100 miles to come see me. And we gave her permanent fixed teeth, upper and lower, all same day. Saw her 2 weeks later. She had already by then gained 5 pounds. So it's a lifestyle thing. It's the ability to eat and
So 70, when they come in and say, I'm a little old for this, that's like
a perfect patient.
That's like no big deal.
No big deal. Walk in the park.
Okay, great. You have more photos.
All right. Next is Betty. So, Betty came to me and she said, hey, Dr. Damon, my bite is not right. If we kind of look there, you can kind of see how she's biting down and her teeth aren't even coming together.
Is it like an underbite of some sort I'm looking at?
Yeah, so she's got a underbite. Her jaws continue to grow after, on in her 20s. And she actually, because of a bad bite, some of the teeth got overloaded and failed. So she was missing multiple teeth. So she had a partial up on top. So in one day, we gave her permanent fixed upper and lower teeth. And look at that smile. The teeth are all in the right spot. They fit her profile. They fit her face. They look like the teeth that she had always wanted.
What's it like when they see themselves for the first time with their new teeth and the sedation wears off and they could actually look at it?
We have some patients, visibly, tearful, tears of joy. They're just very happy. They're very happy that they can leave. There's a lot of emotional baggage that comes with some of these teeth, and they can leave all that in the dust, and it's a new them going forward. So they can, feel more confident in their job. They can feel more confident on the dating scene. They can feel more confident in just who they are as a person.
So no more dentures? Is it true? Do you think that'll be the future of dentistry?
I sure hope so. Nobody needs to have their teeth come in or out. Even if you have a snap in, snap out, or even if you have dentures. I think throw those things in the dirt and the dust and get permanent fixed implants, because that's how we were designed, right? Our teeth didn't snap in or snap out.
Okay.
Right? Our teeth are designed to stay in, and they're designed not to move around. So, yeah, I think permanent implants are the way that everybody should go. So the other thing about snap in, snap out that nobody realizes is there's quite a bit of maintenance there. The parts wear out, the denture breaks in half. There's quite a bit of expense, and over about 5 years, they've paid the same amount that they would have had they started day one permanent fixed teeth. All right, here's our next case here, Randy. So that's Pam. Pam came to me with concerns over her teeth. In fact, she actually said that her granddaughter said something about, Grandma, why is your front tooth broken? So she said, what can we do to fix this? She was also concerned as well, like her other patients, she didn't have any back teeth. And so she needed some support. So as we go through and, do our exams, we really find out that, traditional dentistry is not an option here. But we were able to save her with dental implants and restore her smile. And
looks very nice.
Well, thank you. We try really hard, and if you look there, the teeth are hugging that lower lip just perfect. The shade really matches her complexion quite nice, and they really fill out her smile. So
you're in on the design? Do they get an idea of what their smile is going to look like? Do you have any technology for that?
We do. We show our patients what their teeth are going to look like. We do a try-in step as well. Okay. So as we're developing their final teeth, we're going to try it in. I think it's really important that we give patients the ability to try in their teeth. Look, there's some places out there that'll give you your final set of teeth within 24 to 48 hours. Okay? That has its place. I've done that before. We've done that for some of our patients. But they don't get the ability to try in their teeth.
Okay.
And if these are going to be your teeth for the rest of your life, don't you think you ought to try them in?
To make sure they're comfortable.
At least make sure you like the way that they look, versus just like, here, this is what we gave you.
A lot of companies, and I guess you have some people where you are, where they're trying to say, we're going to do it, the permanent teeth in one day. But you like to give people like a temporary set of upper and lower teeth that don't come out still. They can eat and chew with, right?
Yeah, so we still
But you don't like that where they go directly to the permanent.
Some people will...
Sounds better to me, by the way. Quicker.
Some people will let you go at 48 hours. They will say, these are your final set of teeth, we are done, and then they move on to the next patient.
What's wrong with that?
Well, what's wrong with that is, what about the gums healing, Randy? We all know, and implant dentistry has been around for a long time, the gums need to heal. So we do a faster concept as well. We just let our patients do two things. Let the gums heal so that they don't have any gaps.
Okay.
Right? You don't want any gaps in your teeth. And then we also let them try it in. This is a process where you're going to have your teeth for the next 20 years. I think a try-in process is very beneficial to
So that
our
little
patients.
extra step.
One little
But they're
extra
never left
step.
without teeth that don't come out.
No,
right?
they still get permanent fixed temporary teeth day of surgery. They're walking out with permanent fixed temporary teeth day of surgery. Make sure everybody knows that. But we try to go the extra mile so that we don't have problems in the future. I'd be wary if somebody's trying to give me permanent set of final teeth within 48 hours.
I'm going to rush you a little bit. We have time for photos because I want to make sure you show all of these. You have some good ones.
Okay. All right. Well, here's one of our patients here, and that's Pedro.
Okay.
So Pedro came to see us years ago, and he was facing a denture, and just he in fact feared the denture. His parents had one, and he just saw the problems that they had with it, and he wanted a better solution. And so look at how confident he is in that smile. Look at how harmonious.
It looks like cosmetic dentistry. It looks like porcelain veneers.
This is porcelain teeth. It's the same thing.
Oh, it is? Okay.
Totally. So, oftentimes these patients will come in, they'll be very concerned about function, right? They'll just say, I don't want loose teeth, right? But what happens is as we go through this process, well, now they're, movie stars or superstars. They're so proud of just the overall aesthetics. Their teeth look really good. So, here's Kyle, right? He came in, he was just unhappy with his teeth. He was unhappy. He actually had an upper denture. So he was one of the patients.
Young guy to be wearing a denture.
Young guy. We have our number of patients that, are young or in dentures. Nobody should be in a denture, really, but definitely not being young.
Okay.
But so it's so cool to give this guy the ability and the confidence of giving his teeth back. Look at how good he looks. Okay. Those teeth look like, we did a whole bunch of veneers on him.
Yeah, they look very natural. They're not big and bulky either.
And that's our goal, right? The goal is that the teeth fit the face. And we design each of these cases individually so that everything lines up and matches up. Take a look at this next patient.
All right.
This is Jim. Jim came to me because he wanted to feel confident taking his wife out to dinner. So if we look at his before picture, you can tell he's got a gummy smile. He's got severe periodontal disease. He has a lot of problems.
So no teeth are showing on this guy.
Correct. Yeah. Okay. So over time, patients wind up, some patients will grind their teeth, and then their teeth just kind of go away down to little nubs, as our patients will call it. And he just said, I want to feel confident taking my wife to dinner. And there's his after. So permanent teeth, upper and lower, great. And, Jim said he had less pain after surgery than he ever anticipated, less pain than he had with his teeth. And fun fact, he loved that he could eat Cheetos again and ice cream that didn't hurt his teeth. He said it had been years since he had been able to eat ice cream. So even though Jim had very little post-operative pain, he had no pain in the office during surgery.
So they're all numbed up.
Well, they're all sedated.
Okay.
And we have a number of ways that we do that, and they're all numbed up. But these patients are out for the case. So they are sedated, they are very comfortable.
So they have no memory usually of this?
They have no memory off, they walk out of we wheel them out of our office We use a board-certified anesthesiologist.
That's nice.
So everything is, well above standard of care. I think that's one of the advantages of our center is just being able to provide even better anesthesia than just normal IV. That still works, and I still do that today. I do a number of cases under IV, but patients don't remember anything, and they're just laying there comfortably.
Good.
In fact, they tell us they get some of the best sleep that they've had while we're working on them. Randy, here is another fun one here. This is Karen. Karen, drug sales rep, right? She is in front of doctors all day long. Well, Karen came to me and just said, hey, Dr. Damon, I'm not proud of my teeth anymore. Dr. Damon, I've got some loose teeth in the back. I'm not proud of the smile. What is going on?
Okay.
Well, Karen is, she's suffering from periodontal disease, severe bone infections. And we have to take out everything to treat that, and we restored her smile with permanent implants, top and bottom.
Is this something that husbands and wives or partners do together? Like one goes in first and...
It's always funny. We do have our share of that, and it's always funny to see if the husband goes first or if the wife goes first. Sometimes the husband thinks they're being nice, letting the wife go first, and I kind of think, well, the husband's just being a scaredy cat and he should go first. And there's always these different dynamics.
Yeah, because if you're retired in your 60s, 70s, 80s, when you travel, it's all about the food, the local food.
It's all about the lifestyle.
Yeah.
And not being limited. Can I show one more?
One more.
All right, perfect.
About 30 seconds.
This is Palm. And, Palm came in. We actually put him in a denture years ago. So he was one of our patients that came in, didn't really buy into the implant process, but boy, I tell you what, he wished he did. Okay. And so we finally convinced him, just trust me.
Okay.
Let me do this. Let me take you out of that denture. Gave him a beautiful set of permanent.
What does he say when it's all done? He's all healed up.
He says it's the best money he ever spent, and he says that he wished he would have done it years ago.
Nice.
Hands down.
We're out of time. Somebody watching this, they've heard what you had to say. Maybe they've seen you on TV before, but they're still skeptical. Maybe they have really bad teeth and gums, or they're wearing a denture, but they're still skeptical. What do you say to them? Or they're afraid?
Well, just come in and let's have a conversation. Let's just have a chat. So there's nothing wrong by coming in and just trying to explore the process. They can check out our website, check out our Instagram.
You're all over Instagram, by the way. You've got like reviews, great reviews.
We have
like the online reviews are great.
We are very proud of our Google reviews. We really try to make this process easy for our patients, and the ultimate compliment is when patients that we've treated refer others in, and
that's nice.
And we get a lot of patients that way. So that tells us we're doing something.
Good. Well, Dr. Damon, always a pleasure to have you on the show.
Well, thanks you
again
for having me, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.